As the Gauteng Department of Agriculture and Rural Development, we welcome this debate as it pertains to a matter that is critical not just to our economy, but to the livestock sector and the agricultural sector at large in our province. I'd also like to thank all the honourable members who have made constructive inputs into this debate today, as indeed it is not simply a matter that affects farmers, but affects households and the cost of living and the availability and food insecurity within our province. And so, thus, it is an issue that affects us all. Let me begin, Honourable Chair, by responding to what has been placed before us by Member Engelbrecht, and pick up perhaps where Honourable Chokwe has left off. It's very important for this House to understand that foot and mouth disease is a national crisis. It is not something of the province's making. It is also not limited to provincial boundaries. And therefore, the primary responsibility for management and oversight of the foot and mouth disease is the DA's minister, who is the Minister of Agriculture. And so it's very important that we recognize that all the issues we are now facing have occurred under the DA's very leadership. And the country's livestock sector has been plunged into the worst ever foot and mouth disease outbreak in the history of this country under the DA's leadership. So it is astonishing to me that we are now being made to debate issues that can be discussed in caucus meetings. Let me also remind the members of the DA and Member Engelbrecht that under the Animal Diseases Act 1984, the role of making regulations and disease control measures sits under the National Minister, prescribing animal movement controls, as well as determining vaccination and testing requirements. And the provincial government absolutely does play a role and has a very critical role to play in the implementation and enforcement of those laws. Implementation and enforcement of laws that need to exist. And it is the responsibility of national government to ensure that those laws are put in place. So let me take us back, and it's important we must separate the facts from the fiction here. Yes. At the end of January 2026, before even the classification of the national disaster, Gauteng launched an FMD rapid response plan, which was anchored on 4 key pillars, all of which have been reflected on by members in this House today. Our plan spoke to containment, enforcement, communication, and vaccination. We have remained focused and relentless in executing that plan over the last few months, and have even inspired other provinces, such as the Western Cape, to do the same. So, insofar as enforcement goes, we are working very closely with local law enforcement authorities, and in fact have trained 120 additional crime wardens through the Provincial Disaster Management Centre to assist us with on-the-ground enforcement of livestock as well as illegal movement of livestock in the province. Thank you, MEC. Much appreciated. On the communication front, I want to actually, I've got it open in front of me. On the communication front, we've set up a live dashboard. It is live and available for any of the members to access up-to-the-minute information and accurate data on the foot and mouth disease outbreak. And it reads that we have 297 outbreaks currently, of which 3 have been closed. We have vaccinated 434,000 animals since the beginning of this outbreak, of which over 200,000 have been vaccinated this year alone. Now, this is very important because, again, we cannot vaccinate without vaccines. And a big stumbling block to our ability to respond has been a function of vaccine availability. But ever since we got our vaccines, we have ensured that we deployed the necessary resources, even going so far as to access our own conditional grant funding to procure additional vaccines. And we have rolled out a vaccination program that has seen us vaccinating between 10 and 13,000 animals per week. And I want to bring you comfort, Honourable Nkani. Our focus is very much on communal livestock owners, traditional and rural livestock owners, in addition to the many others that exist in the value chain. In fact, we work very closely with traditional leaders and traditional communities. We have mobile crush pens that we deploy into our township and peri-urban and communal kraals, and we have been actively, this week in particular, we have been actively vaccinating in communal kraals. I myself, I was part of a vaccination in Magagula Heights where we were vaccinating animals in a communal kraal. So we are equitably applying our vaccination program. It's also important to note that so let's also talk about the statistics, colleagues. I think that's very important. And Member Chokwe, you spoke to this, about ensuring that we also bring in additional resources and train animal health technicians and additional support. We have heeded that advice and we have done so. We have brought in 57 private veterinarians who we have employed. We have also advertised vacancies for additional animal health technicians who are being employed. Of course, because they are responding to the outbreak, it is on a 12-month contract. But of course, should we feel that we need to increase our capacity long-term, we would want to employ such people long-term and make those resources available to us. All of those individuals are also, of course, having to be provided with necessary resources such as vehicles, equipment, and otherwise to make their work possible. To make that possible, we've also availed, through the kindness of Provincial Treasury, an additional 63 million rand towards FMD-related activities. And that is to support the four-pillar plan that I spoke about. And it ranges from everything from acquiring the materials required for vaccinations, but also in terms of communicating through community radio stations, through establishing the portal that I showed you, and having a number of other initiatives that are helping us contain the spread. With regards to movement control, this is a very critical one. Gauteng has consistently maintained that movement control is one of the most important tools with which we can combat the foot and mouth disease outbreak. One of the challenges that we have had, again, is in the tardiness of national government in being able to gazette the Section 9 regulations for movement control that enable us to implement movement control measures within the province. Nonetheless, we have taken the initiative and we have mobilized resources through the provincial, through the Department of COGTA, where we have used our intergovernmental relations platforms, our engagements with law enforcement facilities. We are conducting even roadblocks, and there was one actually conducted this week, which was a joint roadblock between GDAD and SAPS. And these are continuing on an ongoing basis. But of course, one of the members touched on this, it really does also boil down to people also ensuring that they themselves follow the law and that there is ongoing bylaw enforcement at a municipal level. Nonetheless, our efforts continue, and once we have the movement control regulations gazetted by national government, I'm sure it will also assist us in enforcing movement control in the province. There's an important point that I want to make, and we must never forget the farmers in all of this. This is not about politics. This is about real people, their lives, their livelihoods, in some cases, generations of their families who have lost their welfare, who have lost their businesses, who have lost the very thing they've spent their lives building. And we take that very seriously as the Department of Agriculture. And our provincial veterinarians themselves have found themselves, having to provide counseling to many farmers because they work closely with various farming communities. So we are not distant from these challenges. We are actively engaging with farmers through, again, a number of stakeholder engagements, direct engagements with farming communities, and working to proactively come up with solutions to help lessen the burden on the farming community. But I want to say it requires leadership at a national level, leadership that unfortunately hasn't always been present. However, here in Gauteng, We're making sure that we are doing everything within our legislative capabilities to minimize the outbreak of FMD in this province, and we will continue to do so. And I would encourage all members who are keen to see us really resolving this issue, provide and continue to provide the constructive input that you have. We really do appreciate it, and we thank you for the suggestions, Honourable Chokwe. We thank you for all of the suggestions that have been made, and we will continue to lead the charge of the fight against foot and mouth disease. I thank you.